So relaxing.
हेलो फ्रेंड्स, आज मैं अपने सेंटर गुवाहाटी में हूँ एंड मेरे पास एक पेशेंट आया है अनदर कंट्री से। सो जानेंगे, बात करेंगे दैट क्या प्रॉब्लम लेकर आए थे एंड व्हाट इज द कंडीशन राइट नाउ ही इज फीलिंग। सो हेलो सर।
Hi doctor.
हाउ आर यू?
I'm good.
सो you came from?
I came from Bhutan. Tezpur.
Bhutan, Thimphu,
Yeah.
capital.
Yeah, the capital.
Wow. And your good name, sir?
𝙩𝙧𝙚𝙧𝙤.
Doji.
Yeah.
Yes, I have lots of friend, Doji friend.
Yeah. Exactly.
And most of they are from Bhutan only. And sir, what was the condition? What was the problem for that you came here?
Okay, I had a problem with my C5 and C6. There's a pinching of nerve. With the pain radiates all over my left arm. So now after the treatment, I'm feeling much better. Like it's like 95% of the pain is gone, except for when I look up towards the ceiling. There's a little mild pain, which I hope through exercise I will overcome this pain.
Wow,
So,
wow, that's great, that's great. So just हम लोग ज़्यादा देर नहीं करेंगे, will not make you bore and we'll start the session. We'll show you some clips and hope you like that, and kindly share this video to all the people who are suffering from pain, and mostly the neck pain and the back pain is a like common problem in this time, and हर एक घर में, हर एक सोसाइटी में, everywhere there is a back pain and neck pain issue. So this video is only dedicated for neck pain peoples, and I hope you will share this, and let's start the video. Almost disc has gone inside and nerve is like almost we can say nerve is free. The circulation is normal.
nice. Okay.
Take a long breath. Slowly out.
So nice.
Loose. Loose. Just leave. I will brace, huh?
A lot of relief.
Wow, great, great. Relax, relax, relax. Wow. Lean back, lean back, lean back. Great. Get up and check how it's feeling.
So relaxing. It's good.
You can walk for a while.
Okay. Yeah, it's all good, doctor.
All good, na?
Yeah.
So, there are some people who want to come here, but they are little scared about the like Assam. They feel scared,
Yes.
afraid that if they will come, anything goes wrong.
Yes,
and
yes,
they-
doctor.
So you came here. It was all your experience.
Yeah.
है ना? You came by yourself, right?
Yes, yes.
And you took the hotel. You
Yes, yes, doctor.
you have already completed your
Yes.
4 to 5
Yes.
days maybe.
Yes.
So what was your experience about the people, about just journey, how you came here? Everything was good, not good? Was cooperative, non-cooperative? If you explain in your own language to our Bhutanese friends, then our friends may learn much more better. Na?
Okay, okay. Kuzamula ni di lexel logi selavilla ngai thimpule. Tena yalema onda bewachin experience lijim de karatsage la be depme na sago sap na beuda. Tebda na doctor da na nurses da kara du karagi menche lijim be lijim be message shuni la. Te zu atsit sita madu da ya doctor gi thimpule be wachin ya doctors de sugi surgery be sela wachin the surgery member na first na Dr. Goswami chika 𝐵 be doctor gi khara matutu bemen chu disnam me surgery cha mangobe te ngachara dugya khapna chiropractor so do to be the certified begop ti khachela certified chiropractor lela like doctor is very qualified. I'm saying qualification nijim do chiropractor be lo mahideb denu doctor has been treating like every day 50 or 60 patient a day. So doctor is really good. So ani bendi ki yakara chendi bero doctor dachiga jena se shunibin la surgery cha madala certified me tele timan se doctor ki training dise nani do. So training dise kara na interested you watching those who are interested na doctor dachiga jebe training e do se shunibin la kadiche.
He is also a very good person, and whatever the instruction I just told him to follow, and he was following all that, and he got a good result, better and best result. And then I hope that every patient and every person who is coming from Bhutan, all they are very smart and humble. They will follow all the instruction, and they will get a very good pain-free body very soon. Right, sir?
Yes.
So
exactly.
we will all do like this.
Okay,
and Karinche.
Karinche.